talking with Debra Whitman from AARP. So, Debra, you said Medicare is not free. How do out-of-pocket costs increase as you age?
So first of all, people pay a lot for Medicare as they're on it. So they pay premiums for Part D, they pay premiums for Part A, every time they go to the doctor they have to pay a copay, and those add up substantially. By the time you're in your 80s, you could be spending about 30% of your income on out-of-pocket healthcare costs.
How does Medigap fit in, and what is the average cost of that?
So average cost is about $4,000 a year for a Medigap policy, and that helps people deal with the unexpected copays that they have to have during the year.
Are dental, visual, and hearing covered by Medicare?
Most people don't realize that dental, vision, and hearing care are not covered by Medicare, and those have to come out of pocket. They can be quite expensive.
Are those included in the 1/3 cost that you mentioned earlier?
Yeah, so a lot of people are spending a significant portion not just on co-payments or on their premiums, but for other services that Medicare doesn't cover, like hearing or dental or vision care.
Mm-hmm. Pharmaceutical costs, especially brand names, the costs are rising 10, 11, 12, even 13% a year. Why is that?
Last year we found that brand name pharmaceutical costs went up 13%. That's a problem within the marketplace where people are paying more and more each year for their drugs.
Do biosimilars or generics make a dent in that?
Generics growth rate has been relatively low, but some drugs have gone up over 1,000% in the last year.
You mentioned Sovaldi as a drug that is a camel's nose in the tent. What do you mean by that?
So Sovaldi is a wonderful drug for treating hepatitis C, but it costs $84,000 a year per treatment. These costs are being borne by employers through about $7,000 copays on people in Medicare, through state Medicaid programs. And that's a huge cost for this one particular drug that many of the health systems hadn't recognized, and they are driving up costs on all of those programs.
And you mentioned there are several new blockbuster drugs in the pipeline. Do you have a range of what they'll cost and how many there are?
We're seeing lots of new drugs, really, really expensive drugs coming to the marketplace. One drug that's going to treat cholesterol is going to cost about $10,000 per year, and we could see millions of people qualifying for that. That's going to drive up premiums for the rest of us as well as the people that have to use that drug.
And how did it evolve that Medicaid now covers 61% of long-term care costs?
Long-term care is expensive. Most people in a nursing home pay for a private room almost $90,000 a year. So they go through their own savings pretty quickly, their entire family savings, and then qualify for Medicaid to help them pay for their long-term care costs.
Thank you.
Sure.